Hello, in this video I'm going to compare the third nerve palsy with the Horner syndrome. In this particular picture you can see that there is slight ptosis on the right side, which is also a feature of Horner syndrome. So ptosis is present in both Horner syndrome and third nerve palsy. So what is the basic difference between these two different types of ptosis? I will discuss in a while, but you can see that the direction, the eyeball is normal. It is not deviated in any direction. And the third point which is to be noted is that the size of the pupil. In case of third nerve palsy, that was dilated pupil, but in case of Horner syndrome, it is constricted pupil. So all these three features would be compared and discussed in detail in a while. So here you can see that we discussed that between the sympathetic parasympathetic nervous system, and this is sympathetic chain. Here you can see that these blue fibers, which are postganglionic fibers of the sympathetic nervous system, they make periarterial plexus along the internal carotid artery, and they reach the brain. And here we can see that they are being supplied to the dilator pupillae. So when in case of Horner syndrome, there would be there would be damage to sympathetic fibers or sympathetic chain. As a result, there wouldn't be any sympathetic fibers, so the dilator pupillae would be paralyzed. So when there wouldn't be any dilator pupillae or paralyzed dilator pupillae, as a result, constrictor pupillae is unchecked or unbalanced. So the balance between these two forces or two different nervous system, there would be loss. So as a result, pupil would be constricted. So this is the reason why Horner syndrome, there is constriction of a pupil instead of dilatation. So in other part, here you can see the again another picture. There is slight ptosis on the left side, and the size of, look at the size of the two pupils. The left pupil is slightly constricted as compared to the right one, but the eyeball position is straight. It is not deviated in any direction, which is a feature of third nerve palsy. So again here this is just simple ptosis, because eyeball is not pupil is not dilated. There are some other causes of ptosis as well, mechanical ptosis, and different types of reasons as well. The one more thing, why there is a ptosis, what is the difference between the two different types of ptosis? So if you remember, I discussed the levator pelvis superioris muscle. It has got two parts. One is skeletal muscle part, other is smooth muscle part. The skeletal muscle part is supplied by the third nerve, its motor supply, and smooth muscle part is actually the part of the levator pelvis superioris, which is supplied with the sympathetic nervous system. So in case of Horner syndrome, ptosis is due to paralysis of the smooth part, whereas in the paralysis of the skeletal muscle part leads to paralysis in case of the third nerve palsy. So this is the basic difference between two. And beside that, third nerve palsy, Horner syndrome, there would be other symptoms as well, which are anhidrosis. There would be loss of sweating on one side of the face, and there would be flushing or erythema due to dilated vessels on one side of the face. So in case of the basic difference, you can do spot diagnosis. Just you don't have to look at the ptosis, but rather you have to find out the size of the pupil and is there any deviation of the eyeball in any direction. So that would be the key feature between key difference between these two different conditions. So you can very well, just by knowing the background anatomy, you can very well differentiate between these two different conditions, and this is how it would help you in your clinical life. Thank you very much.